Oral hygiene instruction and CAMBRA assessment. This video is presented by Caroline Limas. Oral hygiene instruction give benefits to the patient, which maintain good oral hygiene by showing to the patient how to brush and floss with a proper technique. With the proper technique, the patient can remove all the plaque biofilm, and it will help to prevent dental caries and periodontal disease. Caries risk assessment also give benefits to the patient in terms of prognosis, preventive, and therapy. In terms of prognosis, caries risk assessment, it can predict what will happen in the future by assess present patient oral condition. In terms of preventive, caries risk assessment will give idea how to prevent the caries from today and in the future. In terms of therapy, caries risk assessment will give the best option to treat the caries on the patient. This is my patient oral hygiene profile. Her oral hygiene status is fair, and the caries risk is low caries risk. Patient has mild occlusion, crowding anterior teeth, and some gingival recession, also various restoration. Plaque index of the patient. Grab the mirror and show to the patient what is the plaque index is. The plaque index is showing where the plaque like to stay and hang out around the gingival margin, or usually like to stay or accumulate between the teeth, especially if the teeth has crowding and the patient doesn't floss daily. Around the gingival margin, because those area has a rough surface, and then usually the rough surface is not easily the plaque cannot easily remove with rinsing or by saliva flow. It has to be removed by proper brushing technique. In this video, patient will demonstrate how to brush and floss and using other oral care technique at home. Patient brush backward on every quadrant, and patient use soft bristle toothbrush, but she doesn't use fluoride mouthwash. Patient know how to floss properly which using C shape that you can see from the picture, and patient also sometimes use floss with a holder. Unfortunately, patient doesn't floss every day. Oral structure patient. Patient has malocclusion, open bite between 6, 7 and 27, and patient using unilateral partial denture on number 26. The tissue contour on the maxillary, the tissue contour is red, edema, soft and roll on free gingiva, and then on attached gingiva, pink, stippling and firm. On the mandibular arch, on the free gingiva is red, edema, soft and roll, and then on attached gingiva, pink, firm and glossy. The interdental papilla of patient are full. Risk assessment. Patient carrier's risk status is low because patient doesn't have a deep pit-in fissure, does not show white spot lesion, and patient does not use recreation drug, and she drink fluoridated water, use fluoridated toothpaste, and she even chews a little gum even though once sometimes. And patient also rinse with chlorhexidine 2 until 3 times a month. Since the patient have low risk carriers, the plan and recommendation is brush twice a day, and then it's good if patient can do 3 times a day with fluoride toothpaste, and patient floss daily instead of once in a while with a C-shaped technique, or patient can alternate to use interproximal brush or floss with the handle. Advise patients to reduce the number of snacks between meals that contain carbohydrate, especially sugar. If the patient frequently have snack in between meals that contain sugar, that means the sugar will expose more on patient teeth, and the more sugar in the mouth, the more patient will prone to caries. Advise patient to drink a plenty of water and also consume vegetable and fruit as a snack. Since the patient already used fluoride toothpaste, recommend the patient to use mouthwash that contain fluoride 0.05% sodium fluoride that she can get from ACT or Fluoricard. Use the mouthwash twice a day, once in the morning after breakfast and once at night before go to bed. Also advise the patient keep chewing xylitol gums or mints for 5 minutes after snacks, or at least 3 until 5 times a day. Patient will ask, why do I have to chew the gum? Maybe the patient thinks that gum has sugar, but I explain to the patient the gum or mints that contain xylitol cannot cause cavities. In addition, xylitol has an anti-cavity effect against the decay-causing bacteria. The other recommendation for the patient is placing 5% sodium fluoride varnish in the office. Explain to the patient the benefit of fluoride varnish. Placing fluoride varnish is like placing a coat on the teeth. The fluoride varnish, it can help to prevent the caries from consuming sugar, and it helps to reduce sensitivity from drinking or eating hot and cold food or beverages. Before I demonstrate the patient to use modified Stillman technique brushing and floss daily with the C-shape technique, I discussed to the patient the periodontal disease and caries. I explained to the patient that plaque biofilm that accumulate on the teeth work together with the bacteria to release the acid. The acid will demineralize the structure of the tooth and make pores become bigger. This disease is called caries or cavity. Plaque biofilm and bacteria can also cause inflammation on the gum. This inflammation will keep going to take away the attachment that support the tooth. If there is no anticipation action to remove the plaque, this progressive can involve bone loss and the other attachment that support the tooth. This disease is called periodontal disease. In this video, I demonstrate how to modify Stillman technique brushing with angle of the bristle toothbrush 45 degree, and it goes to the pocket each tooth and go back forward gently, and after that wipe off from the gum to the tooth. And also I demonstrate on the lower teeth that the toothbrush bristle goes to 45 angle toward to the sulcus or pocket of each tooth. And the other video I demonstrate how to floss with the C-shape technique. The goal of oral hygiene instruction is to improve oral hygiene status, become good, and giving instruction to the patient how to brush and floss with the proper technique. I also ask the patient to demonstrate the proper technique that I already show from the video, and ask the patient to demonstrate how to floss properly. I recommend to the patient to use electric toothbrush if the patient have a hard time to use manual toothbrush with modified Stillman technique. And also I recommend the patient to use water pick flosser. That's really help to remove the plaque in between the teeth. Thank you for watching my video. I hope this video can help to improve your oral hygiene at home.